Healthcare College is a series of short lessons created to help you understand the healthcare environment that we are working in today. Each lesson is designed to give you insight into the status of healthcare in the nation, the state, and here at Meritus Health. After watching a lesson, you will have the opportunity to discuss the covered topics with your coworkers. The lessons and discussions should help you form a better understanding of the current state of healthcare and how it impacts Meritus Health and your role in the organization. Today's Healthcare College lesson will cover the current environment of the industry, what is the Affordable Care Act, what is an accountable care organization, and how these changes affect Meritus Health and you.
Change is epidemic in healthcare. We are faced with financial challenges, social challenges, and a changing national landscape, which is causing us as deliverers of care to have to rethink much of what we do. This change began about 4 years ago when the early discussions at the federal level around the Affordable Care Act and the discussions associated primarily with the cost of health care and how it was rapidly becoming unaffordable for too many people.
The Affordable Care Act, or ACA, is a bill that was signed into law in March of 2010. The bill requires most citizens to obtain health insurance, and as a result, it will increase the accessibility and reduce the cost of health care in the United States.
One of the things the Affordable Care Act does is expand access to care, because let's face it, the insurance card is what gets us access to care. And so that was piece one, is make it more accessible to folks. Two is we've built a system of symptom and late stage disease treatment. So, we have monitoring of cardiac patients because they've already had an episode and they're in the hospital. And there's this belief that maybe we ought to reorient where we spend and how we spend our money to reduce the incidences of disease. And so you see a real emphasis in the Affordable Care Act on prevention and earlier detection. This idea that if we can prevent a disease, that's the cheapest. If you can't prevent it, detect it early before it's a more complicated disease to treat. And then the third aspect of the bill and the change in public policy is we can't afford what we've got, so we've got to make it's too costly, we've got to make it cheaper. And it's not so much make it cheaper as it is slow the rate of increase in the growth of the cost. And this is the area that's the big push it's the pressure point, if you will.
Medicare Accountable Care Organizations, or ACOs, were created as a result of the Affordable Care Act. An ACO is a group of doctors, hospitals, and other healthcare providers who voluntarily work together to provide high-quality care to Medicare patients. The ACO must meet minimum standards set for 33 quality indicators. When the standards are met, the ACO qualifies to receive the savings that have occurred by providing the right care and by using resources efficiently.
So one of the fundamentals in the bill is this idea that we're going to encourage groups of providers to come together and accept accountability for the population's health in total.
Meritus Health has been designated a Medicare Accountable Care Organization. This means that we will be working with physicians and other healthcare providers to meet and exceed the 33 quality measures that have been determined. This designation will help Meritus Health and its employees focus on providing the right care, the right way, at the right time. As an ACO, Meritus Health has accepted responsibility for improving the population's health. We will continue to implement programs to help achieve this goal in the community, as well as within the Meritus Health workplace. Some ways you may see Meritus Health encouraging healthy lifestyles include community health events, employee fitness programs, and the Go Slow Whoa program in the cafeteria.
We believe we have worked well to develop a strategy to respond proactively to the opportunities present in this change environment. Through our strategic planning process and through discussions, we have a multi-point plan to improve the health of our community and again take advantage of these opportunities for Meritus and for the community. Over the next series of lectures, I hope between myself and those who help me do these, that we can provide you with a working understanding of what all of this means, how it fits together, and how it fits with what Meritus is doing today.
Thank you for watching this lesson of Healthcare College. Please take a few minutes to discuss any questions or comments you have about what was covered in today's lesson with your manager and coworkers. The lesson and discussion are an opportunity for you to learn how the topics apply to you and how you can help Meritus Health reach its goals as an organization. If you have a question about today's lesson, please submit it to the Corporate Communications Department. Your questions will help us create future Healthcare College lessons.